and welcome to tips and tricks of using the side biter therapeutic chewing and swallowing tool. My name is Cheryl Pelletier. I also go by Shasha to people that know me. I guess you could say that's my stage name. I would like to just do some basic instruction today on how to use your side biter kit. Depending on your complete medical evaluation of chewing and swallowing of your patient, you will then figure out which tip to use or go through all the levels. First of all, I want to congratulate you on your passion for feeding and swallowing. I know firsthand after working for over 35 years how difficult it is to support patients that are medically fragile in chewing and swallowing. So I'm just going to start in with explaining how I would use it, and I'm hoping it's going to help you as well. The whole kit actually was designed, created, and manufactured in the USA 100%. What I would do is I would clean it thoroughly with a specially designed brush that's included in your kit with hot soapy water, boiling it, or in the dishwasher, which is very helpful for our patients to keep everything sanitized. This fits in perfectly, so before and after each use you must wash it thoroughly. Make sure that your patient has been completely assessed for any dysphagia that might be occurring pharyngally. So I wanted to point out a couple of things. That this is a 3-part series. It goes from 0 holes to 5 holes to 10 holes. And it's designed as a therapeutic exercise tool for your patient. It's not for an actual feeder like a spoon or a straw, although patients can hold it if they're physically able to. This is a very flexible tube. It has a good grip on it, and it's designed to stand up to avoid any contamination. One of the things that I designed it for is for sensory exploration of food. So you see that I have an apple, some steak, a nice strawberry, some cooked broccoli, and pepper right here. I often will tell families and therapists to use food scissors, which it makes a really nice strip to go inside your biter system. So if you have a patient that can already tolerate particles in the mouth, you could go to a level 2, which has the 5 holes. And this is what I would do. I would have the patient, if possible, pick up the actual food, smell it, maybe taste it, put it right in. This is steak. And I have here a little bit of olive oil, but you could use the au jus or any of the gravy that went with the steak and slide it in. You would want to put it to the biter tip so that the patient can see the food accurately. And each biter tip will hold 5 mLs. So it's kind of nice if you're having your patient chew, take it out, swallow, chew, take it out, swallow, and before you know it, the food is actually gone. You can document that they ate and swallowed, chewed and swallowed 1 teaspoon amount or 5 mLs per biter tip. So you can merely just put more in. If pizza is going well, you would just add more pizza. So it's designed to be with foods that are crushable foods, not sharp foods. So granola isn't a great idea, peanuts, sunflower seeds, they might actually break the biter. I've used it with crushed cereal, potato chips that are crushed, things like that that would escape from the holes and give some flavor contact. How I use it is I educate the patient about the placement in the mouth, where it's going to go. So it's going to go on the side, that's why it's called the side biter. And I would guide them about how many chews they're supposed to do, or have them do some licking to get that tongue elevation up. So you can also squeeze it and some of the food will come out. This is a strawberry that I put in, level 1, And the reason for that is that I would actually add some strawberry juice to be tasty, so that the patient could actually get used to the flavor of it, and you could put it in different parts of the mouth. My guidance for you today as a passionate feeding and swallowing therapist is to look at the holes and decide where the holes are going to squeeze out some of the food. So for example, I'm going to give you a quick example. I cut a slice of apple into a stick shape. I'm going to insert it in here, and when your patient chews on it, you can angle it so that the holes can go in the inner cheek, or they can be angled toward the upper molar or the lower molars, or even toward the inner part of the tongue, and you guide your patient for how to move that food for an effective swallow. Other thing that I wanted to share with you today was that the great success that I personally have had with families in home programs. So picture your most difficult patient and they do well with you, you're all excited, they're chewing and they're swallowing and you're doling out a little bit at a time because you're the expert, and then they have to wait a whole week to see you. Not a great situation, because the family's afraid to give food or they're doing some coughing. But based on your skilled assessment of the patient, you could send home level 1, and you could say, okay, chew eggs and pancakes through the week with level 2, 5 holes. And then when they come see you again, they would have all that time of exercise and experience, chewing, getting the food out, gathering up what was left in the mouth, performing the maneuvers for better bolus transfer. So my patients tell me that they feel a lot more comfortable with a graded, gradual amount coming through. So that makes my heart very happy that they're doing a lot of home work. And the final thing that I will leave you with today is the fact that this tool was very valuable during the pandemic closure of clinics. I'm sure I'm not alone. The people watching know exactly what I'm talking about in terms of going to a telehealth or teletherapy platform. Not easy at all. Very difficult to have somebody on the other side of the screen and you're trying to tell them about how big the strawberry should be. Like, that might be too big for that patient on the other side of the screen, or the family member trying to support them with chewing and swallowing, or even food trials with some of our kids that are have food aversions or feeding disorders, or they don't even accept certain foods in their mouths. So for me, the teletherapy aspect of having them have the tubes or the biter tips on their side of the screen, and I was modeling on my side of the screen, it was extremely helpful. So with that, I'm going to let you think about it, try it out, and by all means, reach out to me at any time with questions or concerns. Again, my name is Cheryl Pelletier. I go by Shasha, and you can reach me at the website or cheryl@noshfeeding.com. And once again, until next time, chew on!